Hi, good afternoon all. Thank you so much for joining. John, would you like to give an introduction? Thank you.
Yeah, thanks, Alex. Afternoon, everybody. Nice to see you all. I would like to take this opportunity to welcome you and welcome Lorraine Hooper to our wonderful organisation. Lorraine joined us on Monday, and I'm pleased to say she's decided to come back for the rest of this week at least. She's our new Director of Finance, IT, Digital Estates Facilities, and essentially has taken over the role from Simon Crowther, who many of you will have known. And I'd also take this opportunity, whilst I have the floor, to acknowledge the work that Alison Wilde did in the interim in that position. So you're very welcome, Lorraine, and I hope you have many enjoyable years with the organisation. Look forward to working with you. Right, usual format, a quick overview piece from me about where we are with all things pandemic, and then in relation to where we are organisationally, and then we'll move into some questions. Got some good questions as ever this week. So the most important thing, just to say that this isn't a cardigan, and is just a normal jumper. I get regular abuse from my executive team about not looking smart enough, but you'll all appreciate some of the challenges of working from home. It's just one of the things I have to put up with, but there we are. So more seriously, it's a good news story, isn't it, as we go through, I think, the challenges of the pandemic. We've had the roadmap out of lockdown from the Prime Minister last week, and we've got some increasingly impressive data around the numbers in terms of new cases, people being admitted to hospital, the death rate, and the vaccines provided, all going in the right direction. And that should give us a real sense of optimism with the spring as well. So winter's passing, hopefully the days getting longer and we'll get the opportunity to get out of our houses. So that's a good place to be. We can't be complacent, and I know I say this every week, but and I have to continue to reiterate it. We've currently got 8 outbreaks live, but again, the good news is that hopefully 3 of those will be closed down through this week, and it's the lowest number we've been at now since sort of October, November of last year. We've got to continue to urge people, even if they've been vaccinated, to continue to practice social distancing, use PPE, and to remain vigilant. We're nearly there, but some of these things are probably going to take, you know, a number of months before we're finally through the challenge. And we do appreciate the real challenges of having to do that across our clinical and operational environments. So a big thank you to everybody that's having to manage that on a regular basis. Bit more detail about the vaccination programme overall within the county. You'll be aware that we're the coordinating organisation for the ICS provision of this. Got off to a bit of a shaky start for all sorts of reasons, and we were a bit behind. But I think overall, I'm in a position to say that we've caught up with the rest of the country, particularly in those really important cohorts, the elderly and vulnerable populations. In all of those cohorts, we're into the mid-90s, 95+% coverage, with roving teams particularly focusing on those people that have been hard to track down, and that puts us in the pack with peer systems. And in more recent weeks, some of the numbers per day and per week that we're knocking out as a system are top performing, so that's really impressive. The vaccination programme is going to need to continue for some months. The completion date has been brought forward, and there's still a lot of conversation and debate required about what is going to become business as usual for vaccinations, and likely that they're going to need to be adapted, and people will need boosters, and it will perhaps start to look something like the flu programme that we're much more familiar with, but that's all ahead of us. The programme of rollout of vaccinations for our patients and service users is continuing. We've got further supplies that we can control and distribute within the organisation, so that's a good position to be in. For our patients, we need to think about how the onward vaccination of people that are discharged, and need to make sure that they're followed up and have their second doses. So there's a bit of logistics and challenge around that. And we're just starting to plan for severe mental illness cohorts in the community to receive it too. In terms of our staff, we're about 7,500 staff completed their first dose out of just over 9,000. We'll continue to urge people to access the vaccination. There's lots of information available through Connect, or you manage how you do that. Just to be clear, it's because there are occasional questions about, is this mandated? It's not. We hope to be able to persuade people with arguments and evidence that it's the right thing to do, but it's not mandated nationally. And then to start to finish my initial sort of heads up summary, there's, given the good news and what I've been saying, that the thing that is sort of turned into people's minds now is, okay, so what's next? How do we get the NHS? How do we get services? How do we get the trust back onto business as usual, or normal, or whatever that is? And it will be true to say that already the national and regional teams are starting to bring that into the start of conversations now. Prefaced by, we can't let our guard down. There's still a lot to do, but particularly in acute care, where there's really significant backlogs and waiting lists that you'll have been reading about and hearing in the media. That is a really pressing challenge as to how, for example, cancer operations restart, and how that's all put into recovery, and the consequences of how that works whilst COVID is still relatively active. Similar conversations for mental health, learning disability and community services, although we do have very different ways of running. We don't have big backlogs of elective care, but I know that operational teams will be very cognizant of the demand and acuity that's likely to hit over the coming months, and we need to make sure organisationally that we support all our staff to be able to make that transition, and that goes without any reference even yet to our own staff's mental health, wellbeing, recovery and chance to recuperate. So we are very aware that this is going to be an important time that we manage, and that we just don't go from the real busyness of managing COVID to piling on demands for to get us back to business as usual. So that's a piece of work the executive is starting to look at with senior leadership team about how we do that in a way that supports staff and links into, for example, making sure the wellbeing services are visible, the support's there, people know how to access it, for example, that people can take their leave and get a break. And so that's a big piece of work for us over the coming months. And then to finish on my sort of introductory summary before I hand back to you, Alex, just to reiterate my thanks to everybody that's been involved in the work in recent months. It's been a massive ask, and as ever, it's important to recognise the brilliant work, the passion, commitment everybody's puts into this. Trust's in a relatively good position. We've just been talking this morning, the executive team, about the soon-to-be released National Staff Survey figures. I think it's the 11th of March next week, which is a really good news story for the first time in a while. So that's a good bit to end on. So there you go, Alex. That's introductory points from me. Over to you.
That's great, thank you, John. Just to highlight, Kumar has put in the chat, and please let us know the uptake percentage of vaccination for both White and BAME staff. And I don't know if anybody has those figures to hand, or whether we can come back to Kumar.
Hi, Alex. Hi, Alex. It's Claire. I was just typing in the chat, actually. So we've vaccinated over 1,000 BAME colleagues. We've got approximately just over 400 colleagues, BAME colleagues left to vaccinate, according to the return that we did yesterday. I think Richard Cottrell might be on the call as well, but I was looking at his data return in terms of just providing that information.
That's great, thank you. And I know Richard's got his hand up, so if you want to come on, Richard, that'd be great, thank you. And you're on mute.
Better. Okay, as regards percentages, at the moment we're on 79% non-BME staff, with about 60% BME staff vaccinated. However, it's fair to say we've noted that discrepancy, and Catherine and Tracy Yolanda have been doing considerable amount of work to, I suppose, encourage our BME staff, our BME workforce to take their vaccine. Well, we've had a discussion around it this morning quite aptly, and we are looking at some targeted comms for all staff who haven't had the vaccine, pointing out the benefits and actually trying to encourage those staff to take their vaccine, or noting that it's not mandatory, but actually it's really positive to have your vaccine for the NHF and the staff we protect. So we'll be doing some targeted comms around that for all staff, but we have noticed, like I say, the discrepancy between White and BME staff uptaking their vaccine. Is that okay? Thanks
ever so much, Richard. Hopefully, Kumar, that covers your question, but if you want to add anything, please do put that in the chat, or say something, put your hand up. That's absolutely great. Thank you. And Catherine's just highlighted that the numbers have risen considerably since the BME staff network session on the 18th of February, which is fantastic. So thank you ever so much. And Yolanda said, if any colleagues would like to record a message or video about what it's been like for them taking the vaccine to encourage others, please get in touch with the comms team. That's a great piece of work as well, so thank you ever so much. Moving slightly back up the chat, Michelle had asked a question, and it was a question actually that had been picked up as a theme for today, and I don't know if Claire wants to respond to this. Michelle has highlighted there was an interesting conversation on the Facebook group about pay at Notts Healthcare being lower for some staff groups than at other trusts. Is this something that you're aware of, and are there any plans to address this? It seems like a flaw in the agenda for change process that this is happening. And the question that I'd picked up from Facebook, excuse me, was, does anyone know if Band 2 HCAs are moving to Band 3 to bring us in line with Broadmoor and Ashworth mental health hospitals? Claire, I don't know if you want to answer that, respond to that. Thank you.
Hi, yeah, thanks Alex, and thanks for the questions. So there isn't a trust-wide plan to basically bring all Band 2 colleagues onto a Band 3. It's picked up in specific areas, and the jobs in those areas are banded according to the agenda for change criteria. So that's how we do things across the organisation, and it's our plan to keep doing things in that way, because we do have different roles across the trust, different asks, but it is something that we also do keep regularly under review. And just for some assurance around that, it's also something that our staff side colleagues do monitor quite closely and do raise and pick up with us. So we do continue to look at it. In terms of pay at our organisation being lower than that of others, that's not something that I've picked up on per se. We do all work in accordance with Agenda for Change. So if there is something specific, a specific area where people do think that's a problem, they could let us know, and I can take a look at it, and I can take a look at the specifics and try and understand it. And clearly, if it is something that we are out of sync with, then we will seek to address it. But it's not something that broadly I'm aware of, I'm afraid.
Okay, thank you ever so much, Claire. Thank you. Catherine Concher's put a question in for Lorraine, and I don't know if you want to come in. I know you've put something in the chat, Lorraine. Just about, she's asked, welcome Lorraine, what are you looking forward to most about working for Notts Healthcare?
So as I said in the chat, it's a really difficult question to answer, because actually there's a huge amount, even in the 2.5 days I've been here, I've got a big long list of all the people I'd like to meet and all the conversations I'd like to have. But right now I think it's very definitely getting to know the services. Some of the services here in the organisation I've worked with in the past in different organisations, so have some familiarity with, and some I don't. So it's very definitely getting to know services and those that run those services, and how what I do can help them to deliver what they want to do, which I can only imagine is the best possible care to our patients.
Fantastic, thank you ever so much, Lorraine. And there's a question that's been sent in, and not meaning to drop you in at the deep end, but I'll just ask this question of you at the moment within your new role. And it's, I work at the Liaison and Diversion Service. I've been with the team for about 7 months. During this period, I've discovered that there are better ways of improving tasks, managing workloads and our core duties. These will lead to reduced stress for staff, improving our mental health, improve efficiency, reduce errors, and among other things. I'm currently doing an MSc in data science and artificial intelligence, and have created a programme that my colleagues suggest would really be an improvement over the current system. My question is, how can I present my idea to the trust, and how does the trust approve or implement specific software? I don't know if you want to take that from the IT perspective, Lorraine.
Yeah, absolutely. So firstly, really good to hear about people undertaking bits of education and undertaking that MSc. And it's really good to have the question. As I'm sure you can imagine, I'm not at all familiar with how we do things yet, but absolutely definitely want to encourage innovation and making sure that we can do things to make people's lives easier with IT. So if I can, I'd like to take that away. I don't know if that question was provided anonymously or whether there is a named individual, but I'd very much like to take that away, and I will pick that up, because it's definitely something I'd like to encourage.
That's fantastic. And Maria, would you like to come in on that question with regards to the innovation?
Yeah. We recognise that across the organisation we've got an opportunity. Now Lorraine's in post, we can look at innovation, transformation and improvement. And one of the things that we want to do is work together to ensure that we have a real consistent approach across, because at the moment it's a little bit siloed, it's a little bit disparate around the organisation. So there's a bit of transformation over there, some improvement over there, some quality improvement over there. And innovation really is kind of like missing out. So we already have recognised this, and over the last 3 or 4 months, myself and Sarah Furley and finance have all started to think, right, how can we do that so much better as an organisation? And what the question kind of like puts into is how do people come forward these fantastic ideas that we know that you've all got out there, and you know, so how do we make the most of those ideas, innovations, and like Mark says, Julie Hankin has set up an innovation group to start thinking about this as well. So we have got lots of ideas, we've got lots of things in train, and when we've got it all formulated and put down and properly, then we'll make sure we come out to all of you so that you know how to put those ideas forward.
That's great, that sounds fantastic, thank you very much. Going back to the questions within the chat, Jonathan Saxton has asked, in the news it talks about some organisations possibly implementing a no jab, no work policy. What are your thoughts on this? And I don't know if you want to talk to this, John.
Yeah, what a great question, Jonathan. Thank you. And these are thoughts, okay? So, and I guess a number of people are having similar sorts of thoughts, really. And there's a question later on that is in a similar vein, really. So, what do I think? I think I'll work backwards. I think ultimately it will be a decision that may well be taken out of our hands, because I don't think there'll be some organisations that do and some organisations that don't in the NHS. I think that a formal decision will be made one way or the other, and that trusts will be asked to implement it or not. On the one hand, you could argue, for example, that it's no different from a number of other, passports, if you like, that people will need to show when they gain employment, whether it's hepatitis or what's the other one, that TB, and there are probably a number of others, aren't there, that you've got to show that you're inoculated against before you gain employment. So from that perspective, you could say, well, this is no different. I suppose the one of the biggest questions at the minute is the issue of how much the vaccination, how effective the vaccination is in reducing transmission. And that's one of the big unanswered questions at the moment, and there's very little data on that before the mass rollout. I think there's some emergent data that's if you're vaccinated, it also reduces the transmissibility of that infection from one individual to the other. But I think that's very early days, and I don't think we're anywhere near having a conclusion on that. So I think I don't think there's anything that's going to be imminent, because the obvious thing is, if it doesn't reduce transmission, there isn't very much point having a vaccine passport to say you've been vaccinated, because you could be completely asymptomatic and bring it to your place of work. So my final thoughts on it is that two of the real big issues has been that one I've just mentioned, is that there's an awful lot of people that are asymptomatic and spread it, but it's very contagious. And some of the very closed clinical environments that we work in, I mean, Anne-Maria and others will be aware that, when we do have outbreaks, it can hit a very large number of staff and patients very quickly. So we do have to make sure that we put in measures, all the measures possible, to reduce the chances of that happening. This may be one of them. So they're my thoughts for what it's worth, Jonathan. I hope that's helpful. I do think it will be a national decision. I think it's probably just a bit early for those conversations to be concluded yet. I don't know if anyone else has got any other thoughts on it.
Claire, thank you.
Yeah, I was just going to add that it's something that is being discussed. It is being discussed widely through NHS employers as well. Actually, the point that John talked to about IMS and VACs that happen as part of people starting work, but I think it is a discussion point, and at the minute we're focused on people making a choice, trying to encourage people to make the choice to have the vaccine and support them with any questions. So if you've got questions or queries about it, our job at the minute is to be able to answer those and work with you to enable you to make the right decision for you and make an informed choice. And that's the kind of approach that we are taking and continuing to take. Thanks.
That's great, thank you, Claire. And just while you're on screen, I'm going to skip down, because I know that you've got to leave at 12:30. But just from your perspective, because having looked through Facebook, I know there's been some confusion over the position on carrying forward annual leave for this year, and I know there's been some new rules. Are you able to confirm exactly what the rules are and what the trust position is, please?
Yeah, so our current policy for this leave year, which is 20 going into 21, is that people can carry over up to 5 days leave. In exceptional circumstances, people can carry over up to 10. That needs to be discussed locally through people's line managers. So that's our current policy arrangement, and we agreed that last year. What I would say is that the reason that we made the changes about the carryover to 5 is because we recognised people were having to make a number of changes personally and also to support us to deliver the services at work, which we're hugely grateful for. So we are being flexible with people about that carryover, but it is 10 in exceptional circumstances and 5 if people have not been able to take it. And the final thing just to say on that is that having rest while you're in work, so getting breaks is really important, and taking a break from work is fundamentally important. And whilst everyone's not being able to do what they might normally do during their annual leave, still having a break is really, really important. And that's why we've encouraged people to take the leave where they can. And to just on that, lots of staff thankfully have done that. Actually, people have been really sensible about taking their breaks and managing that through the year, and we're hugely grateful for that as well, because it helps us to manage the onward delivery of our services. And yeah, thanks for everybody's flexibility on it. So hope that helps and helps clarify.
Thank you ever so much, that's great.
Thanks from me, Alex. I've got to go.
Okay, thanks Claire. See you later.
Bye all.
Bye. John, there's a question that's been sent in and linked to what you were saying previously about vaccines. Given that vaccines aren't expected to prevent transmission, the idea of a vaccine passport makes no sense. Will the Trust add its voice to the thousands of professionals and organisations like the UK Medical Freedom Alliance who oppose this idea that is currently being debated by Parliament? I don't know if you wish to respond to that, John. You're on mute, John.
You'd think you'd know by now, wouldn't you? I can't remember what I was going to say. Okay, right. So yeah, it's really important, isn't it, that I think that we have the opportunity to ask and answer these questions, because I think they're part of the national debate. So the first line is, given that the vaccines aren't expected to prevent transmission. So I don't think we can be as clear cut in that statement as with many things with the pandemic. It's never black and white, and often the position is perhaps somewhere in between. So my view is that I think there's more evidence to come on whether and how much they reduce transmission. I don't think they're going to stop it completely, but in the body of the question about whether we will add our voice and lobby, the short answer is no. That's not our role as an organisation. There's nothing to stop individuals getting involved and having their say, obviously, and hopefully that goes without saying. But in terms of us being an NHS trust provider, our role is very clear in the terms of provision of services. If asked, we may proffer views for specific pieces when asked, but this wouldn't be a particular part of the debate that we would get involved in.
Okay, thank you ever so much, John. And just to highlight some of the conversation that's happening in the chat for the anybody that's viewing the recording. Jenny's highlighted, I took a lot from the BME discussion, which was led by medics. In particular, I was concerned that the vaccination had come out too quickly and may not have been tested adequately. The medics discussed how a lot of research had already been carried out with bird flu, swine flu, etc., which are also coronaviruses. So they had a standing start with this one, and that's great too. To highlight that. And also Jenny's highlighted that there's going to be a recording of the medics at the end of the week, and it'll be available for everyone on Connect next week, so which is fantastic. There's further questions that have been sent in as well, and I don't know if Yolanda, you'd like to answer this one. It's International Women's Day next Monday on the 8th of March. Is the Trust doing anything in particular to recognise this?
Yes, we absolutely are. The comms team are looking for people that are happy to record their stories, either verbally or in print. So this year's theme for International Women's Day, which is on the 8th of March, that's Monday, is Choose to Challenge. And it's all about calling out gender bias and inequality. So our very own Catherine Conchart has agreed to promote every day on Twitter, celebrating the women who inspire her, but locally, nationally, regionally. John Brewin, as the chief exec, is outnumbered on the executive team by women. He's the only bloke. The rest of us are all women. So let's just say that we feel that we have that representation. And Karen Cisse is also recording her story about the vaccination programme and what that's meant to her. So we're celebrating that. But if any staff have got anything they want to record, you know, to celebrate this, then give us a call in the comms team, drop us an email. Thank you.
That's great. Thank you ever so much. And Anne-Marie in Newham has put women power. Fabulous. Thank you. John, there's a question that's been sent in, and I don't know if you want to say this from your perspective. Can you tell us about things returning to normal, in inverted commas, and business as usual as we come out of lockdown? Is there a trust plan? And I know you touched on this briefly within your opening section.
Yeah, thanks, Alex. And just to say, I'm really looking forward to the 8th of March Women's Day. I think there's some really positive stuff that we can put out there and celebrate and recognise. And joking aside, I'm really proud of the Trust Board and the Executive team to be in such a position. So yeah, business as usual. When are we going to go back to normal? I did reference it earlier. It's a bit difficult to gauge because every sort of narrative needs to be prefaced, doesn't it, by, you know, as long as we don't slip into wave 4 or whatever it is. There are no at the moment indicators that that's imminent anytime soon, but you've got a sort of sneaky wariness, isn't there, that we were in this position in July of last year, and then look what happened. But again, if you go underneath the headlines and look around, that it's very different compared to that time last year. And you know, and the obvious thing is the vaccination programme is so advanced, and we know an awful lot more about what works, what doesn't work. So I think that you know, we're still seeing an awful lot of COVID-related activity across all sectors, whether it's primary, community, secondary care, and social care too. And I think that's going to take some time to flow through the system. If we can keep a lid on the number of cases that become unwell, so I think that's going to be really important. So we watch the news, don't we? So those daily number of cases is reducing, but I think it probably come down to a level where it's going to stay for a bit. But the key point will be that the vast majority of those people won't be coming seriously unwell, needing admission, and you know, hopefully won't require intensive care and won't be leading to the death rate that we were seeing a month or so ago. And so if all that pertains, then I think as we move into April, May, a bit like the sort of national roadmap out of lockdown, I think a similar trajectory will play out through the NHS and social care, that we'll start to get back on the bus, if you like, of return to business as usual. And we've got a big piece within the executive, the Restoration Recovery Group, that has been like many things, put on hold while we're still in the middle of it. We're just starting to sort of look at again as to exactly what some of those big decision points are, whether it's stepping down the incident control from daily, the redeployment of staff back to previous roles, when and how soon can that happen, the move from essentially a lot of the COVID costs are block top-ups, and all the usual sort of annual planning had been put on hold. But that's all going to come back into the offing pretty quickly, I think, for the reasons I was saying earlier, that there's a very pressing backlog, and the country hasn't paused in its need for requiring all sorts of health intervention. So I think it's difficult to be precise. I'm aware I'm perhaps rambling a little bit and perhaps being a bit vague. I think some of that will crystallise over the next few weeks, and we'll get a much clearer picture. But the mist is clearing, and I think by late spring, summer, I think we'll probably be able to start to recognise that this is much like work used to be. And of course, we need to make sure that we continue with some of the opportunities and benefits that we've been able to pull out of the pandemic. For example, being able to do things like this.
Yeah, that's great. Thank you ever so much, John. That's great. Just to reference the chat, there's been quite a healthy debate going on within the chat. So Dr. Call has added, perhaps now we need to consider positive discrimination for men at senior levels. And Yolanda's added equal power, and Maria said absolutely, Dr. Call. And then and Catherine Concha has added that just to clarify, positive discrimination is illegal, positive action is not. But valuable point, Becky Sutton, as exec champion for gender equality, is working with the steering group to look at key areas of underrepresentation in the workforce, including men into nursing, AHP roles, etc. Catherine has also added, linked to the 8th of March, Maxine Davis, new E&D lead in local mental health, has agreed to do an article for Connect, as she used to work as a women's officer. So welcome, Maxine, and thank you ever so much for doing that. That's fantastic. There's one final question which has been sent in, and I know that all execs were really keen to answer this question. So, John, I don't know if you want to go for this first. Rio has been playing up with lots of people having issues. Will this be fixed soon?
Yeah, thanks, Alex. Good question. There is a number of issues that have been identified, and we're in negotiations with the supplier. My understanding, this isn't in the answer, is that the way Rio works is that it's almost done on a calendar, in terms of you can do various intervention upgrades at specific times, and you can't do it on an ad hoc regular basis unless that's changed. So that might be one of the reasons why they're waiting for a specific window to fix some of the more fundamental issues with it. I don't know, I might be wrong. We've got a distribution list that we're using on email to let people know of workarounds and fixes. So if people are individually or teams still having issues, which I'm sure they probably are, to report them into IT, and we'll make sure that the fixes that we have identified are able to be notified to them. I don't know if anybody else has got any additional bits, but that would be my take on it, Alex.
That's great. Thank you ever so much, John. Michelle has put into a question into the chat. Some people are very keen to get back into the office as we're all working at home. Are there any thoughts on when we might be able to start talking about this? And obviously that's linked to what you were saying previously, John.
That's a really good question, Michelle, and I couldn't agree more. And I've sort of my sense on this, I think I've probably said it before, that there'll be some roles that almost entirely depends on coming into the place of work. There are some that can be much more aligned and supported by home working, and then there are a number of roles that are sort of probably a mix of the two and a sort of spectrum in between. I think now we need to be starting those conversations about what it's going to look like for the future. And I think we've got an opportunity to redesign some of this in terms of the trust really supporting home working, being clear about how we can support people to do that, what the offer is. There's also, for example, there's been all sorts of challenges, hasn't there, around mileage claims for some people that are based on the old tariff that, as the pandemic hit, meant that they were losing out. Hopefully we'll address that. But there's all sorts of things. Working from home is great in lots of ways, but if it's all the time, you run the risk of losing that connection with people, and people within your team, people within your organisation. That's quite a fundamental part of why people come to work, because it's being with your team, isn't it? That can be the sort of fun bit and the bits you take out. And if we said that wasn't going to be available, that would be a very daft thing to do. So I think there are some quite sophisticated bits of work that we need to work through to develop how this could work for everybody. But I think in answer to your question, Michelle, yeah, we need to start to begin those conversations now, because it's going to take a bit of organising and a bit of planning.
That's great. Thank you ever so much, John. We've only got a couple of minutes left, but I don't know if anybody wishes to say anything further. Is Anne-Maria still on the call?
Yeah. So you're going to be surprised to hear that I've got nothing to say today. I haven't, genuinely. Not only because I normally give you a big long list of things, don't I? But no, we've closed flu. That's closed down, and really we're kind of like cracking on with sorting any outbreaks. I put in the chat earlier, actually, the last outbreak I declared was on the 21st of February. Now, the last time I did that, I had 3 in one day, after I'd said we hadn't had any for ages. So please, don't do that to me. But no, honestly, we're doing really well. So I've got nothing to add at the moment.
That's great. Thank you ever so much. If there's nothing else, then I'll bring the meeting to a close. John, you've unmuted.
Well, just
say something.
Say thank you. Thank you, Alex, and thanks to everyone for organising this. Thanks for everybody's contributions. So it was a really good conversation today. Some really good questions and some good chat as well in the chat box. So thanks very much. Great stuff, and see you all next week.
That's great. Thank you ever so much. You said the recording will be available, and please send in any questions for next week to staff engagement. Thank you. Bye.
Bye.
Bye.